mouths are made up of the upper and lower jaws. When we open our mouths, we can see the gums on the upper and lower jaws. These white objects on the gums are called teeth. This baby is only 5 months old. His teeth haven't yet come out from the gums. Now he's 8 months old. 2 separate teeth have grown through the lower jaw. His first tooth began to appear about 1 month ago, and the second one followed later. Now he's 10 months old, and teeth have started to appear on his upper jaw too. This little boy is 3 years old, and he now has a set of teeth on both jaws. This boy is 6 years old, and his first tooth has fallen out. This boy is 7 years old. The small hole was formed by a tooth which has fallen out. This new tooth is quite different from the others. It's bigger in size, has a yellowish colour and serrated edges. It erupted into the space where the old tooth was lost. This boy is 12 years old and has a full set of new teeth. You will realise from what we've just said that a person has 2 sets of teeth in a lifetime. The first set of teeth will appear around the age of 6 months. These first teeth are usually called milk teeth. At around 6 years of age, the milk teeth begin to loosen and eventually fall out one by one to be replaced by the second set of teeth. This second set will have replaced all the milk teeth by the time a person is about 12. These newly grown teeth will never fall out. If one of them is lost due to an accident or tooth decay, no new teeth will take their place. These teeth are called the permanent teeth. Newborn babies are toothless. They can only drink milk or water. After their milk teeth have grown through, babies can start trying other kinds of food. To start with, they have only their front teeth. At this time, they gnaw food with the front teeth and try to chew. When babies are around 1 year old, they can chew up solid food more effectively as the molars begin to come through. So the main functions of teeth are for chewing food and helping us to swallow. Normally, we only see the part of the tooth above the gum. This part is called the crown. Other parts of the tooth lie under the pink gums. If we could see through the gum and the jawbone, we would see either 1, 2, or 3 roots on each tooth growing down into the jawbone and holding the tooth firmly in place. If we cut a tooth vertically, we can see its structure. The hard tissue of a tooth is mostly made up of dentine. In the crown of a normal tooth, enamel covers the dentine and forms the outermost layer of the tooth. Enamel is a flat, shiny and clear tissue. It lies as a thin film on the surface of the tooth, through which the colour of the dentine is visible. Enamel is the hardest tissue of the tooth, as it has a very high mineral content. Under the enamel is the dentine. There's a space in the innermost part of the dentine called the pulp cavity. The pulp cavity contains blood vessels, nerves and connective tissue. The blood vessels nourish the tooth, while the nerves transmit sensations from the tooth to the brain. The thin tissue covering the root is called cement. The soft tissue attaching the root to the jawbone is called the periodontal membrane, and this holds the tooth in place to the jawbone. There are several different types of teeth, including incisors, also known as front teeth, canines, premolars, and molars. Different types of teeth have different sizes and shapes. They work together, each with a different function to cope with different types of food. There are 20 milk teeth, including 8 incisors, 4 canines, and 8 premolars. There are 32 permanent teeth, including 8 incisors, 4 canines, 8 premolars, and 12 molars. The first permanent molar is behind all the milk teeth. Since it usually comes out at the age of around 6, it's called the 6-year molar. By around the age of 12, the remaining 28 permanent teeth, with the exception of the wisdom teeth, have mostly come through. The wisdom teeth erupt between the ages of 18 and 25. They're situated behind the second molars in the upper and lower jaws. They're usually called the third molars. If 4 wisdom teeth become fully grown, an adult will have 32 permanent teeth. However, not everyone has 4 wisdom teeth. Some people may have only 1 or 2 or even none at all. Tooth decay and periodontal or gum disease are the most common tooth diseases in Hong Kong. According to a survey done in 1999, 37% of Secondary 1 students were suffering from tooth decay. On average, each person had 0.8 teeth that either showed some decay or had undergone some restoration. Moreover, 96% of teenagers were found to have mild periodontal disease. The presence of plaque is certainly a major cause of tooth decay and periodontal disease. Let's look more closely at them. Tooth decay and periodontal disease are caused by a bacterial layer adhering to the tooth surfaces. This bacterial layer is called plaque, and its presence is not immediately noticeable. The bacteria in the plaque digest and absorb the food particles stuck between the teeth or on the tooth surfaces. When digesting the food, the bacteria produce acids which demineralize the enamel, resulting in tooth decay. We should notice that not only sweets or other sugary foods contain sugars, most of the food we consume has sugar added to it to make it taste better. Some carbohydrates, such as cooked starch, will also be dissolved into sugars in the mouth to produce acid, leading to tooth decay. Early tooth decay may not bring discomfort to the sufferer, so it's not easily noticeable. However, if we get into the good habit of having regular checkups, tooth decay can be detected at an early stage and proper treatment can be provided. If, however, the decay spreads into the dentine, the person may then feel pain. If it's not treated, the decay may spread to the pulp and considerable pain may be produced. When the pulp is infected with bacteria and becomes necrotic, the pulp may contain pus and an abscess will develop in the root. There's been some interesting research into the relationship between tooth decay and dietary habits. Every time we eat, the bacteria in the plaque will digest the food to produce acids. This chart shows that the pH value in the mouth will decline or become more acidic quickly after we've eaten. Demineralization will occur on the enamel of the tooth surfaces, increasing the chances of tooth decay. However, our saliva is alkaline, so it can neutralize acid. The chart shows that the pH value on the tooth surfaces will increase slowly sometime after eating, allowing the dissolved minerals to be deposited back into the enamel. But we should note that it takes some 30 minutes to complete the process. If this person eats continuously, the frequency of the production of acid will increase and tooth decay will occur more easily. Periodontal disease is also caused by plaque. The bacteria in the plaque release toxins to irritate the periodontal tissue, causing periodontal disease. If the plaque is not removed, it will be calcified and eventually turn into tartar. The rough surfaces of the tartar enhance plaque accumulation and continue to irritate the gums. The common signs of mild periodontal disease include red and swollen gums and the easy bleeding of gums when brushing teeth. If there is a mild periodontal disease, a suitable toothbrush and dental floss should be used to clean the teeth. When periodontal disease becomes severe, in addition to red, swollen and bleeding gums, some people may experience recession of the periodontal tissues, that is, the periodontal membrane and the jawbone below the gums. The recession of these tissues results in the formation of a periodontal pouch. Because the periodontal tissues have receded, teeth may loosen, change in position, or even fall out. If this happens, we must seek treatment from a dentist. Tooth decay and periodontal disease are caused by plaque. To avoid these, we should start by cleaning up the plaque. If we brush our teeth properly every day, the plaque can be removed effectively. Toothbrushing can clean the plaque on the tooth surfaces, but it cannot remove the plaque from tooth surfaces that are close together. Some people use toothpicks to clear out food stuck between the teeth. However, this isn't a good practice, as it may easily damage the gums. The proper way to clean adjacent tooth surfaces is by flossing. Dental floss can be used to clean away the plaque and food particles between two teeth. The Water Supplies Department of Hong Kong has been adding fluoride to drinking water since 1961. Fluorine is a non-metallic element, and fluoride is its compound. It's been proved by medical experiments that adding a suitable amount of fluoride to drinking water can prevent tooth decay. This is because fluoride can help minerals to be deposited on tooth surfaces to strengthen their structure, thereby preventing acid damage. Fluoride can also control bacterial activity in the plaque and reduce the chances of tooth decay. Most toothpaste advertisements claim that fluoride in toothpaste can help to prevent tooth decay. Is this true? Yes, it's true. Medical research has proved that fluoride toothpaste can further reduce the chances of tooth decay even where fluoride has already been added to drinking water. Therefore, remember to brush your teeth with fluoride toothpaste because it's effective in preventing tooth decay. One habit that has an opposite effect on your dental health is smoking. It not only produces bad breath and badly stained teeth, but is also harmful to general health, causing illnesses such as heart disease and lung cancer. Moreover, the chance of smokers developing periodontal disease is 5 times higher than that of non-smokers. For the benefit of your health and appearance, do not smoke. It's always better to prevent getting tooth disease in the first place. Having regular dental checkups will allow the dentist to detect tooth diseases and treat them at an early stage.
According to a secondary school student oral hygiene survey held in 1999, almost every student from secondary 1 to 3 had mild periodontal disease. In other words, secondary school students have not grasped the techniques for cleaning teeth. Do you still remember those techniques?
The main purpose in cleaning teeth is to remove the plaque which adheres to the tooth surfaces. We should brush gently to avoid damaging the gum and debrading the teeth. Choose a toothbrush with a small brush head and soft bristles. Place the toothbrush with its bristles at an angle to the gum. Start with the innermost tooth, working on 2 to 3 teeth at one time, so that the movement will not be too drastic. Scrub the teeth gently, using roughly the same force as you would use to hold a pen. Move the toothbrush backwards and forwards about 10 times to thoroughly remove the plaque. Finish brushing the outer surfaces of the upper right molars, moving the brush forward systematically. Then, brush the outer surfaces of the incisors and continue onto the left molars. Then onto the lower teeth, moving systematically from the left molars at the back to the incisors at the front, and continuing until you reach the right molars at the back. Now clean the inner surfaces. Start brushing from the inner surfaces of the upper right molars in the same way as the outer surfaces. When brushing the inner surfaces of the incisors, hold the toothbrush straight like this, brushing from the gum line towards the tooth edge. Then go on to brush the inner surfaces of the left-hand side molars. Now turn to brush the lower teeth, starting to brush from the left molars at the back. As your tongue lies alongside your teeth, you should brush the teeth with the tongue relaxed. To brush the incisors at the front, hold the toothbrush like this, just as you did with the upper incisors. Brush from the gum line towards the tooth edge until you have finished brushing the right molars. Finally, place the bristles of the toothbrush on the upper molars. Brush backwards and forwards the chewing surfaces. Brush the left-hand side when you have finished on the right. Then brush the chewing surfaces of the lower teeth similarly. Remember to brush both left and right-hand sides. Apart from toothbrushing, we should also use dental floss to remove the plaque from tooth surfaces that are close together. Take a piece of dental floss approximately 20 to 25 cm long. Tie both ends 3 times to make a loop that will not come loose easily. Use the forefingers and thumbs of your hands to hold a 2 cm length of floss. Hold it straight and gently slide it between the teeth, using a sawing motion. Use your fingers to control and change the angle of the floss. Hold the floss tightly against the adjacent tooth surface of a tooth and gently slide it up and down to remove the plaque. When one side has been cleaned, wrap the floss around the other adjacent tooth surface and repeat the up and down motions. Then use a clean part of the floss loop to clean up the adjacent tooth surfaces of other teeth. To ensure that each adjacent tooth surface has been cleaned thoroughly, the procedure should be done sequentially from left to right and from lower to upper jaw.
To maintain good oral health, we should have healthy living habits. These include regular oral checkups for proper treatment and learning the techniques of effective teeth cleaning. It is very important to keep our teeth and mouths clean. Every day, take time to brush your teeth in the morning and before bed, using a proper toothbrush, fluoride toothpaste, as well as dental floss to clean the gaps between the teeth. Of course, we should also eat less often and not smoke. This is how we can maintain oral health and successfully prevent dental disease.